Hello, Judy. Nice to meet you. And my name is Guy. I'm a nurse practitioner. And today you are here for muscular exam, right?
Mm-hmm.
Okay. And do you have any concerns today?
No.
All right. Do you have any pain right now?
No.
Any shortness of breath? All right, good. Can you tell me your full name?
Judy Jin,
All right. And can you tell me your date of birth?
1984, 17th July,
Okay. And what's the date today?
Thursday.
Okay. So my patient is alert and oriented, and her grooming is appropriate, and there's no acute distress. So now I'm going to wash my hand, and let's start. Okay. First, we're going to examine your temporomandibular joint, which is located on your face anterior to your target bone on your ear, which will be on the side right here. So as I can see, there's no swelling and or tenderness, and those are good. So let's test the range of motion now. Okay. And open your mouth, close, and pull your jaw forward. Pull your jaw forward, backward, side to side, left and right. Okay. Do you feel any pain or numbness?
No.
Okay. So my patient, the temporal mandibular joint is range of motion is smooth, and there is no clicking, popping, or locking. All right. So now let's start to examine your shoulder. So first, I'm going to inspect your shoulder for any tenderness, swelling, or discoloration. So those are none, negative. So now I'm going to palpate your shoulder for your start from the sternoclavicle joint alongside to the clavicle and until the criminoclavicle joint. Okay, looking for tenderness, swelling, or crampus. So those are negative. Right, and now I need you to turn around. Okay, so I'm going to palpate the scapula from down upward along the scapula process, looking for tenderness, swelling, or crampus, deformities. So those are none. All right, so turn around. So now let's test for the range of motion, the shoulder range of motion. Okay. So I want you to standing up. Okay, backward a little bit. Okay, and put your hand on the side, and let's do yeah, that's good right there. Shoulder extension, like that. Just one shoulder each time, all the time. Okay, pull up. Okay, pull it back down. Okay, on the side, and now do the shoulder flexation. Pull your arm as back as possible. Okay, pull it back. Okay, let's do the other arm for extension. Yeah, go up and go all the way up. Okay, put your arm down, like that. Flexation, back. Yeah, good. Okay, and pull it back. Let's do the arm abduction. So which will be put your arm side. Okay, up. Okay, the other one, abduction, and up. Okay, and now we do adduction. Start from my right arm. Okay. All right, the other arm, adduction. Okay, and now we do the shoulder external rotation. All right, The other arm, external rotation. Okay, I want you to turn around and do the internal rotation. Okay, the other arm, internal rotation. Alright, good. Alright, you can sit back now. Do you feel any pain during those motions? Okay, so your shoulder has a full range of motion, and so that's a good thing. Oh, sorry. Standing up again. Let's do arm drop test. So which will be pull your both arms 90 degrees along the side. Okay, and pull your arms slowly down. Slowly pull your arms down. Okay, go. Alright. Alright, sit back up. Any pain during this process?
No.
Okay, so the arm drop test is testing for the rotator cuff spring or tear or fully tear. So those are negative, so that's good. Next we're going to test examine the elbow. I'm going to inspect the elbow for redness and or tenderness. These are negative. Alright, and now we're going to palpate the elbow. Any pain? Okay, so the elbow is there's no redness or tenderness on the elbow. So and also there's no nodules. Nodules could be a sign for bursitis or arthritis. Okay, so those are negative. Okay, so now we'll test the range of motion for your elbow. So try to put your arms 90 degrees like that. Okay, and then we'll do the elbow, put it back down. We'll do elbow extension for 90 degrees all the way up. Okay, put it back down. Now straight your arms as straight as possible. That's the flexation. Alright, so these are about 180 degrees. Those are good. Alright, and now we're going to do the pronation, which put your bend your arm 90 degrees. Show me your palm. And now we'll do a supination. Okay, I'll put like 90 degrees. Okay, and supination. Okay, pronation. Okay, that's good. So your elbow has full range of motion, and it's neutral and no interruptions. Okay. So next we're going to examine your hand, your wrist, and your hand. So by inspection, your hand has no swelling, redness. Okay, and now I'm going to palpate the 8 carpal bones, and also the metacarpal phalangeal joint, the MCP joint, and the interphalangeal joint, and now is the DIP joint of each finger. Alright. Same process on this hand. Do you feel any pain? Alright. So now let's do the wrist range of motion. Do extension. Okay, flexation. Alright, and turn it side to side. Okay, do lateral bending. Okay, and move your fingers. Alright, good. So now let's do your hand and your wrist and the finger has a full range of motion. Now let's do the 2 tests, which is called the T-nails test and Fallon's test. So the T-nails test. Let's do the T-nail test. Tell me if you feel a numbness or pain. Okay. The other hand. Do you feel numbness or pain? Okay, so put your hands like that. Okay, push. Do you feel numbness or pain? Okay, so these are so the Tinel test and the Follen test are the tests for the medial nerve compressions. So those are negative. Okay, let's do the next. We're going to do the cervical exam, which will be your neck. Okay, can you turn around, please? Right here. So by inspection, so your cervical is a natural inline position. Natural inline position, and also so there is no swelling or discolorations. Alright, and now I'm going to pound. Any pain? Okay, so turn around, please. So we'll do then the cervical extension test for the range of motion. So try to use your chin touch your chest. Okay, look at the ceiling. Look at the ceiling all the way. Just okay, and do lateral bending rotation. Do try to use your ear touch your shoulder. Okay, the other side, and rotating left and the right. Okay, so your cervical has the full range of motion. So alright, that's good. So now let's do the lumbar thoracic exam. So what we'll do is you can standing up, turn around. Alright, so I'm going to lift your dress up a little bit so we can see the back of your shoulder, okay? Your back. So as we can see, the lumbar, the spinal is inline neutral position. There is no abnormal curve to the side or rotating to the side. So which means, and also the shoulder is even bilaterally, so which is there's no scoliosis, lordosis, and sphenosis. Alright, so now let's do the okay, go back. Now I'm going to palpate the spine. Start from the foreset and all the vertical process. And the paravertebral muscle. And the scolioelastic, the scolioelastic joint. Alright, so those are normal. Okay, turn back. Now we're going to do the range of motion test. Okay, on your spine. Let's do the hyperextension. So you bend forward as far as you can. Bending forward as far as you can. Okay, go back and do flexation. Alright, okay. Now we do the side to side, the lateral bending. Okay, we'll start from the left. Okay, and now to your right. And now we'll do a rotation. Okay. Okay. Any pain? All right. So the range of you have the spine have the full range of motion. So now let's you walk to me to here, and then go back, walk back. Okay, and walk back again. All right there. Okay, good. So The patient has neutral gait and the walking is smooth without interruptions. All right, that's good. Okay, you can sit back down, please. And then next, we are going to I'm going to inspect your legs and your feet, looking for any redness, tenderness, and the swelling, and the palpate the cuff for tenderness. So those are negative. And the skin is good, no discoloration, no swelling, tenderness, and no eruptus. Alright, so now let's check the range of motion on your hip. Put your leg straight. Okay. Alright. We'll check your hip extension first. Any pain? Okay. Hip extension. Alright. We'll do the hip flexation. The hip flexation. Okay. And now let's do it the hip abduction. Abduction. Adduction. Okay. So the abduction and adduction. We'll do the hip rotation. The hip abduction, extension, flexation, and rotation. Any pain?
No.
Okay. Hip inner rotation, external rotation. Okay. All right. So now don't push against my hand. Okay. And now push against my hand. Okay. The other one. Push against my hand. Okay. Push against my hand. Okay. That's good. Okay. Now let's do the so your hip has a full range of motion, which is good. Okay, now let's get up. I'm going to examine your knee, okay? So by inspection, there's no swelling, redness, or nodules. Palpate. No swelling, no tenderness or cryptus. Alright, test for range of motion. Okay, so pull your leg straight. Okay, pull it back. Alright, pull it back now. So, patient knee has the full range of motion for the extension part. So now let's do the knee rotation. Okay. Inner rotation, external rotation, inner rotation, external rotation. That's knee flexation, as we can see. Okay. Knee flexation. Okay. And now let's test for knee resistance. Okay. And like that. Don't let it drop. Okay. Push against my hand. Okay. Push against my hand. Alright, that's good. The other one. Push against my hand. Push against my hand. Okay. So the knee has a full range of motion and a normal resistance. Next, I'm going to examine the ankle and the feet by inspection. The ankle and the feet has no swelling, redness, or cracks, and no nodules. And now I'm going to palpate the ankle and the joint. So there's no swelling, tenderness, or cracks, or deformities. Now let's test the range of motion. Okay. All right. So let's do the ankle extension for ankle extension. Okay, flexation. Okay, and now we do abduction. Okay, and now you make a circle. Let me see. All right, good. This feet do ankle extension. No, an extension. Yep, and then flexation. Abduction. Adduction. Okay, and make a circle. Let me see. Okay, and the move your toes if you can. Okay, and this one, move your toes. All right. Any pain? All right. So the ankle and the toe has full range of motion. And now let's do a couple tests. Then we'll be done with. Okay. So first is the pure leg straight. Okay. First test is the let's test the McMurray's test, which is test for hernia disc herniation. Okay. Yeah. Any pain? All right. Do you have any pain? All right. Good. Okay. Now sit forward. Sit up. Now we're going to do test for your ACL tear. Okay. So I'm going to pull your legs forward, but you don't need to move anything. Okay. So the though I cannot move the knee is I try to put the knee forward, but there's a negative. There's no ACL tear. Okay. Now we'll pull the knee backward. I cannot see a movement either, so there's no PCL tear. So okay, negative for ACL tear and negative for the PCL tear. And the last test will be the I think that's it. So all your joint has a full range of motion, and there's no tenderness, cracks. So I think everything is normal, like have a full range of motion and full normal strength. Okay, do you have any question for me today?
No.
Alright, so thank you for coming, and I expect to see you in a couple weeks.